I'm Dr. Hara Trouli. I'm a doctor, a medical doctor. I have been trained in orthopedic and trauma surgery and also in musculoskeletal medicine. And for the past 10 years, I'm practicing in performing arts medicine. For a long time, a musician was not considered as an athlete. But if you think about it, all these small groups of muscles that they have to work in tandem, it is an athletic activity. In the literature of performing arts medicine, and particularly musicians' medicine, we see injuries in all kinds of musicians now. And of course, every type of musician has different kind of injuries. A common type of injury that we see in the clinics are the overuse injuries. And it's when we overload the capacities of our bodies. So the long hours of practice, the very demanding pieces that we play, excessive anxiety that may go with perfecting a piece for exams, for performances, for shows. So when we go into that overuse mode, if you like, we use the muscles, the small muscles or the bigger muscles, they're used in a non-physiological way. That can cause fatigue. It can cause an actual injury, an actual breakdown of our musculoskeletal system in a microscopic way to start with, and then in a bigger scale. And it can cause a pain syndrome, which may be difficult to resolve. So preventing these situations is very important, and health education comes into the equation, but also understanding them or having some early signs and catching them as quickly as possible. A lot of musicians like to delay going to the doctor or asking for some kind of health advice. Any pain that doesn't go away, particularly after we finish the activity, after we finish our rehearsal and we go home and we still have a niggle or we have some kind of a discomfort, burning sensations, the pins and needles, the numbness that might be experienced. And I'm going to add to that anything that might be affecting our performance, personal anxieties, personal problems, issues that might be impacting on how we practice and how we perform. Those might be risk factors for further injuries as well. The instrumentalist has to think about what postures they're going to take in order to play that instrument with the least possible biomechanical strain. Some of these postures are dynamic, which means they're changeable, they will change over time, and some are static. And the static postures, the contractions of the muscular system that are consistent and persevering, these are the ones that we seem to think that they are the most dangerous ones for injuries. Like in every musculoskeletal condition, the earlier we detect a problem, the better the outcome. And our clinical examination, particularly for musicians, is what we would do again for every other patient, a physical examination, but we would also like to examine them together with their instrument. And this is a very important phase in the assessment, to see how they adapt. They can show us their difficulties, we can look at the biomechanics, and they can perhaps relate to us their problems when they're playing the instrument. So this is very, very important. If we don't achieve a diagnosis or some diagnosis at that point, then we will refer for further investigations. So we may want to ask for an ultrasound scan. We may want to look at the nerve behavior. Then we discuss with the patient what is the best way forward. Mostly adaptations, modifications of either technique, posture, or modification of lifestyle in terms of keeping fit for your music, conditioned for your music, may be enough. There are other conditions which may need supervised treatments. So we may refer to our colleagues, our physiotherapist colleagues, for instance, where they may need to have a course of treatment for an injury. We may refer to a specialist rheumatologist if we have found that this is a condition that needs their attention, or we may, of course, refer them to a surgeon if this is a condition that needs surgical treatment. So we have a lot of options here, and usually musicians' medicine works within a network of specialists. We do tend to cross-refer so we can get the best result for the patient. The sportsman that does their jumping or their running, this is not how they train all day. They will do other exercises, they will go and do different, what we call cross-training. And in the music world, this is not very well practiced. So we play our instrument, we play our repertoire, we spend the X number of hours doing our practice for our exams, for our performances, for our shows. But when it comes to maintaining the conditioning of our fingers, our hands, our arms, our necks, our backs, this can be done outside the instrument. So thankfully, we have a range of ways, exercises, either supervised or not, other activities that we do promote depending on the case, such as yoga or Pilates for the musicians, which can be used as cross-training, as parallel training to maintain that ability to practice and perform the instrument and the long hours.